Partners for a Healthier Community is a Springfield-based organization working to improve the well-being of residents of Western Massachusetts' largest city and beyond. Executive Director Jessica Collins joined us recently to talk about her organization's mission and efforts to make our region a better, healthier place to live.
There are 24 public health institutes in the country, and we are part of the national network of public health institutes, of which there are 40 of us. So it's rather a special group to be a part of. And what it means for us is it's given us a structure to do our work and to add more service to the work that we do, and specifically in research assessment, community-based research assessment, program evaluation, and what had been our and continues to be our bread and butter, I call it, which is convening, which is coalition building. So being a public health institute has really helped us define ourselves, what we do, what we bring, the value we bring to Western Massachusetts. And it also, it really helps our region, helps us in our region really sophisticate ourselves in the way that we use data, share data, and then can really monitor and track our progress as a region.
Let me pick up and follow up on what you just said about data, because in the emails we exchanged for you to try to bring me up to speed for this discussion, there was a great sentence that I just love. You said basically Partners is trying to sophisticate our region's ability to have access to and to use local data. Numbers, facts, figures, that tells you what's needed and when you're addressing the need.
And so we've been able to, a couple years ago, we put out a Springfield Health Equity Report, Jim, and that really helped us look at health outcome data and be able to stratify that by race and ethnicity to really see, okay, if there is a prevalence of asthma, who is really suffering from that the most? And then how can you tailor interventions that are much more specific and impactful because you're actually reaching the very people who are experiencing it the most. And so having access to local hospital data, data from the Massachusetts Department of Public Health, schools, clinics, etc., it's very helpful to now be able to have the capacity to analyze that and present that in ways that our community partners can use it.
And sadly, and correct me if I'm wrong on this or if things have changed since I last looked at numbers, we still do see that people in poverty, children in poverty, and people of color still do tend to suffer disproportionately.
Absolutely. And right now, nationally, there's a saying that your zip code is sort of better than your geocode in determining the quality of your life and the length of your life based on health. And that is very sadly the truth as well here in Western Mass.
I know Partners for a Healthier Community has, within the last few months, released a couple of reports on two very critical health issues locally. I want to kind of go through them one at a time. Opioid overdose in Western Massachusetts. People are talking about this across the country, but the numbers you folks looked at when you compared our area, whether it was city of Springfield, which was very high compared to statewide numbers, really every county in Western Mass was higher than the statewide number of opioid addiction deaths per 100,000 in population. It really was startling to me, and I'm sure to all of your people.
Yeah. Well, definitely we've known for years in the urban centers that substance abuse has been an issue, and now really we're seeing this nationwide, quite frankly, hitting rural, and it's across class. You know, opioids affect across class, and it's getting a lot of attention, needed attention in the prevention vein. We were real proud of that report. Bay State Health commissioned us to do that report, to bring in data, use local data, and it actually, we were able to distribute it to all the Western Mass chiefs of police, trying to educate everyone that's involved, you know, from different sectors about where the prevalence is and where the communities are that need more potential prevention interventions. So yeah, it is shocking, and hopefully these new policies statewide will have some effect for all communities.
I want to real quickly mention, in the numbers you compiled, Hampshire County was lowest in our area, and it was below the state average, just to make that clear.
Yep.
in fairness. But I wonder if overall the numbers you found didn't ring some bells the other end of the state, the eastern part of the state, where so often they don't think of this region as having some of the same problems, some of the same concerns. And suddenly you could show them numbers and say, look, this isn't just a Boston problem or a Suffolk County problem. This is critical from one end of the state to the other.
Yeah, well, I think folks are aware that it is statewide. Worcester, I don't know if you remember, but last year Worcester had a pretty sad experience, and the public health community hit back hard on that. I think it's really helpful to have Western Mass data, like you say. It gives us a little bit more evidence, and credibility might not be the right word, but for our legislators to really be able to pick up these reports and be able to advocate for us, I think is very powerful.
So believe it or not, 30 seconds left in our time. Resources and support for what you find is needed is the key, correct?
Mm-hmm. Well, resources for every in every regard, for sure. And we have generous, foundations and corporations that are, everything we do is with multiple partners, and that's funders and other community partners. So it's very important, and we know where we want to put our resources now by looking at that data.
Jessica Collins, Partners for a Healthier Community, thanks so much for what you do. Thanks for coming in.